Welcome to Season 3 of the To Health With That podcast, where we break up big topics into small bites. I'm your host, Dr. Amy Neuzil, and I'm joined by my dear friend, women's health and fertility expert, naturopathic physician Kate Naumes, to break down infertility, hormones, and the whole baby-making shebang. This week and next, let's deep dive into endometriosis. This topic is near and dear to my heart because my mother struggled with endometriosis for her entire reproductive years. She had terrible pain, monthly hemorrhages that often needed transfusions, and an infertility diagnosis. So it was a big surprise when she was able to carry me to a viable age. She suffered so much, and at that time, I didn't have the knowledge to help her. So this week, let's talk about endometriosis and fertility.
Sounds great. So we've mentioned endo before, and people with endometriosis classically present during their reproductive years with symptoms like pelvic pain, pain with menses, or pain with sex, also infertility and or an ovarian mass. So many of the things you just mentioned earlier. It affects about 10 to 15% of women of reproductive age. And of women with endometriosis, 30 to 50% are estimated to have infertility. So that's high.
Ouch.
Yeah. And of women who present with infertility, 25 to 50% are estimated to also have endo. So endometriosis is a really important topic when we're talking about infertility.
Oh, wow. And so what are the main symptoms that you see bringing people into your office with endometriosis?
Yeah, they're almost always coming into my office for painful periods, sometimes pain with intercourse, and or they aren't getting pregnant easily. And they usually do not have a diagnosis of endometriosis yet. And then I'd add that the additional symptom is super heavy menses.
That makes sense.
Yeah.
That makes sense. So what tests might an ND like you or I run in addition to what their OB-GYN has already probably ordered?
Right. And honestly, normally the OB-GYN isn't really running much. So if the client is coming to me and they're focused on fertility and they have already gotten a diagnosis of endometriosis, we're often supporting post-surgery, like laparoscopy, or recovery or supporting IVF success. And so I'm not running additional labs. However, if we have the time and the budget for it, I'm prone to order salivary hormone and urinary metabolite testing because that gives us additional insight into hormones like estrogen. It helps us identify markers of inflammation and oxidative stress, and it helps us to look at their stress response via the HPA axis. And I won't run those hormone tests if they're currently on the pill just because of how that affects the tests.
Right. Makes the test sort of invalid.
Right.
Yeah, absolutely. I agree. And salivary hormone testing is just wonderful. It can be a really helpful window into a person's sort of cycle and pattern.
Absolutely. Yeah. And I love to do that testing while they're cycle charting because I can compare the cycle charts to the results of the hormones. And that's really fun to see how they support one another.
Yeah, absolutely. Absolutely.
Yeah. I'll also run a CBC if it hasn't been run and the client has had heavy menstrual bleeding as part of her endo picture, or if she reports symptoms that I'm thinking are iron deficiency anemia, because I want to make sure we address any iron deficiency anemia since she will absolutely have more energy once she's replenished her iron stores.
Right. Having red blood cells that work.
Yes.
Who knew?
Yes, exactly.
Yeah, I'm kind of shocked by how often something as simple as a blood count is overlooked. And I mean, especially for women who are hemorrhaging monthly. I mean, that's basic.
Yes. And it's so inexpensive to run.
Exactly.
Yeah,
It's really accessible for anyone.
absolutely.
Quick pro tip. If you need a blood count, but do not have the funds to get one, donate blood. They do a
Great.
quick check
Yeah.
before you're allowed to donate blood. So it'll at least tell you if you're anemic or not. So if you get declined for blood donation, you need iron.
Perfect tip. I love that.
So we know endometriosis decreases fertility. Um, what can you tell me about endometriosis and pregnancy outcomes?
Yeah, great question. There is an increased risk of miscarriage, ectopic pregnancy, placenta previa, which is where there's some placental tissue that extends over the internal cervical os, or just the top
Mhm.
of the vagina, the bottom of the uterus, um, as well as some unexplained bleeding during delivery and postpartum, which we call antepartum hemorrhage and postpartum hemorrhage, and preterm delivery. So there are some serious potential consequences.
Absolutely. I mean, some of those are incredibly serious. Ectopic pregnancies can be life-threatening, and
Absolutely.
as can antepartum hemorrhage and postpartum hemorrhage. So,
Yeah.
yeah, and preterm birth obviously is a risk for both mama and baby.
Right. And if you've corrected the anemia in prior to going into conceiving, or you make sure you're correcting it during pregnancy and you do have a hemorrhage, you're less likely to be in dire straits. So again, we really want to address the iron deficiency anemia in these women and keep them nicely stocked with iron.
Well, yeah, plus you won't feel like you've been dragged behind a truck for 3 miles before,
Yes.
going through the birthing process, because
Yes.
that matters.
It's absolutely. Yeah.
And what about additional support via natural or integrative medicine?
Yeah, this and PCOS are some of my favorite areas where the integrative approach is just awesome and better than one or the other standalone.
Completely
So,
agree.
yeah. So as an ND, as you know, we're really well trained to help clients build healthy nutrition, exercise, sleep, and stress management habits, as well as supporting them to have healthy relationships. And these things impact almost all acute and chronic illnesses, and it's often totally unaddressed in mainstream medicine. So, of course, I'm addressing those things. My fertility lens for endo is decreasing inflammation via herbal and dietary approaches, plus stress modification, and helping them to build their healthcare team. For example, referring out to pelvic floor PT for pelvic pain, or therapy as needed for emotional issues that may come up in association with endo. And then with diet specifics, I'm focusing on a plant based diet, high fiber, low fat, green tea, decrease intake of alcohol, red meat, and caffeine. I'm increasing dietary use of anti inflammatory and aromatic spices like turmeric and rosemary and ginger and burdock and flaxseed. And then I'm thinking about omega-3 intake like flax, evening primrose oil, and borage oil.
Yes,
Mhm.
absolutely. And I think for patients it's really easy to be like, oh, stress management and diet and whatever. But honestly, you and I have both seen patients fundamentally shift with these interventions. So, if you're willing to put some effort into it, this can be the difference between having a healthy pregnancy and having a successful pregnancy and not.
Totally. And just the pain with endo is just life sucking. And we really have a lot of tools to help with the pain that mainstream medicine doesn't have to offer.
Yeah, absolutely. Absolutely.
Mhm. So, again, specifically related to fertility, I like to help the client when the doctor has said, watch and wait. If they've had surgery or they're refusing surgery. Some women just don't want to get the surgery, and that's acceptable. Or they want to prepare for IVF. Those are all really great entry points for naturopathic medicine. And hopefully, we can reduce pain, reduce the estrogen burden, decrease inflammation, and then boost antioxidant function to help increase fertility.
Amazing. Dr. Kate, thank you so much. And next week, we're going to talk a little bit about why actually targeting inflammation, antioxidant function, and stress response are so incredibly important with endometriosis. Thank you so much for listening today and sharing your time with us. If you like this show, please follow and maybe even leave a review, or like and subscribe if you happen to be watching on YouTube. Visit naumesnd, naumesnd.com, or to healthwiththat.com for more information about Doctors Kate and me, Dr. Amy.